technology is well managed, is able to change the life of millions of people in the world.
Welcome to Hearing Health Today. I'm your host, Craig Sharp. On today's episode, A Connected Hearing Care Ecosystem, we'll be speaking with Dr. Eliana Cristofari, Director of the Cochlear Implant Center at the Hospital de Cicalo in Varese, Italy. Dr. Cristofari is both a surgeon and an expert in rehabilitation. She and her team have built an innovative and multidisciplinary approach to care, and we'll learn from her about how they've built this new care model and some of the lessons they've learned along the way. This is a podcast for hearing health professionals. If you are a person with hearing loss or a member of the general public, please seek advice from your health professional about treatments for hearing loss. Dr. Cristofari, thanks for joining us on this episode of Hearing Health Today.
Good morning. I'm in Italy, and so in Italy it's 7 o'clock in the morning, and it's early, but I'm very happy to be here with you.
Fantastic. Well, thanks for agreeing to wake up early to join us for this interview. I wanted to kick off by asking you a little bit about some of the rehab work that you've done in Italy. I know you're one of the leaders in Italy around remote care and remote rehab, and I was just curious if you could provide us a little bit of insight into some of the work that you do with remote care in Italy.
It's an interesting concept, care anywhere, especially in this period. We have lived and we are living the COVID time, and so it's a very, very special moment in the history of humans. And we started in 1995 with teleconference video rehabilitation. Why? Because we were sure that the future will be different from the past. And we are sure that a new generation of humans is incoming. And social media is available for anyone and anywhere. And people love staying in contact, especially with the doctors that we know.
1995, I mean, that was such a long time ago. What did remote care look like then? Were you using dial-up internet?
It was very, very difficult. In our department in Varese, we welcome people from all over Italy and from other countries. Telerehabilitation is for us the most efficient way to reach them. Telerehabilitation video conference was introduced in 1995, and the initial idea was to reduce costs for all those families who lived in other parts of Italy.
Were those mostly rural patients?
All of Italy. You have to imagine that Varese is a small town of 80,000 inhabitants, and our department is in Varese and is located in the north of Italy. So it's a beautiful area with 7 lakes, beautiful mountains. And also you have to imagine that from the south of Italy to Varese, there is a long trip.
Why do you have patients coming all the way from the south of Italy? Is there not a center closer to them?
No. In Italy, we have many centers for audiological centers for hearing aids or cochlear implants. But at that time, in 1995, the centers, especially for children, were few. Now, now we have many other centers in all of Italy, but the history is the history.
So you're doing remote care or video, it sounds like video rehab in 1995. How did you do that? Like what technology did you use?
At the beginning, it was very, very, very hard because the technology was not so good at that time. The companies didn't invest in that technology.
Yeah.
And so it was very, very difficult for us. But we were lucky, and the government at that time gave a financial contribution for the PC and for the internet connection. And we started using the Skype platform in 2003.
Yeah.
That could be easily downloaded, and so with a camera was very, very cheap, and the PC families could connect with us.
So you started using Skype in 2003.
Yes.
What did you use between 1995 and 2003?
We had only an Italian system, and it was connected to the fixed telephone.
Yeah, okay.
And it was a very, very hard system to improve.
Did that have video?
Yes, we had video. The quality of the video at the beginning was not so good, and also the voice, and some connections were not good. Now, usually, we can conclude the 90% of connection in a very good way with full satisfaction for us and the families.
When you're connecting with families, going back to 1995 and then to 2003,
yes,
were you connecting with patients and their parents at their home, or did they have to travel to like a clinic or something where they had a good internet connection?
We started at the beginning only at home. And why? Because our method have some key points. The first key point is early diagnosis. The second one is the immediate application of hearing aids and sternal vibrator.
Sure.
And the continuing life as thought with normal hearing.
Yeah.
The third one is total family cooperation, individual rehabilitation, and a full school integration and monitoring of changes. So, for this goal, we need the mother in children. And the mother is the key point of our method. And we want to follow and to guide the mother of children at home.
Okay.
And so usually the children come to the center. It depends from the program, once a week, once a month, once a year. It depends from the case, from the severity of the disease. But we follow regularly at home all the mothers once a week or twice a week, depends. And over the time, we change this program.
Okay.
And so now we connect also the schools, other professionals, the companies, the sons in the case of the elderly himself or with the sons at work. It depends.
So when you are connecting with parents and their children at home, yeah, would you also then like have the school join that same call, or do you sometimes just connect with the school separately?
It depends, because we can connect also with many people, many professionals in the same time. Usually it's only one connection at home to work with mother or with the professional to discuss about the professional questions. But another thing we do usually is very interesting. We collect all the teachers of all the children we are following in Italy once a year to explain them what deafness is, what technology is, how to manage technology, and to discuss problem about deafness because it's fundamental for us, because teachers live every day with the children.
Yeah, so it sounds like the teachers of children who have hearing loss are really important in that diagnosis and or treatment pathway.
Yes. We think they are strategic because they live with children many hours a day, and so they are able to observe the children and to give us many information. We have prepared many questions to the family, to the school, because we need these informations, because we have to check and to monitor the disability of that patients at home, school, or in the daily life.
Dr. Cristofari, you mentioned that core to your method is connecting with parents at home. So parents of children with hearing loss in their home, and you do that remotely. Why is that so much more important than having someone come to the center?
Because if at the beginning we started with video conference only to reduce the cost, we observed that also the patients living in Varese, so it was very, very easy for them to reach the center. They reached the final results more rapidly than the other ones. And so we decided to use video conference for all the patients because we can monitor their results at home, at school, at work. It depends from the patients. But the most important thing is to guide them during the rehabilitation program. During the day, they stay in the center. We train the mother, we train the adult, we train the elderly to work in video conference with us. And we explain the exercise to do. And they go home and they do this exercise under our supervision.
So regardless of whether a patient or family lives a kilometer away or 500 kilometers away, it sounds like you guys use video because you've seen better results. Is that fair to say, like from a rehabilitation perspective?
Yes, this is the real goal, because we noticed that many patients followed by video conference reached in a very short time the final result. And so this is the reason why we started with video conference with all the patients. What's the reason? We really don't know, but we think that probably they can control their anxiety, they can stay at home, and so they are in a familiar environment, and so they are more quiet and they can work better. And we are looking during the rehabilitation their work. And there is some very funny situations, because sometimes we connect with them early in the morning, and so we say them they are having breakfast.
Real life.
We can see the real life. And so we are very familiar with the families, and this is fantastic for us and for them, because they are very quiet. Another aspect is that we have the app on our mobile phones, and so the patients can reach us every time, everywhere. And so it's a little bit difficult for us to manage them, but if they have a very, very, very important problem, they can reach us, and this is the difference.
So when you first proposed to do rehabilitation through video, did people think you were crazy? Because that must have been pretty abnormal. At that time? At that time,
yes, we were crazy for them, but also now, because only during COVID time, many professionals discovered the video conference before they didn't use. And so I think that the world is changing, and we have to change.
How is video rehab different today in 2020 than it was, in 1995 or in 2003 when you started using Skype? What are the main differences that you see today in the way that you deliver rehabilitation?
The first one is the technology, and it's free.
Yeah.
At that time, the families had to pay something to the telephone company to have a video conference at that time. Now it's free. The second reason is that it's a common way to communicate, and so all the families are familiar with this kind of communication. Also, the elderly now are very happy to use this technology. Now they are able to connect by themselves.
So how do you do the training? What does that look like?
When the patient comes to our center, we show him how to use technology, and we train him many times if he needs. And so he becomes familiar with technology, and is very quiet, and so it's not a problem. You can try it.
Is that normally over the course of like 3 months or a year, or how long does it take to typically train folks to use the technology? Is it just like one visit sometimes and that's good enough, or?
No. It depends from the patient, from the family. It depends from many things. And usually in 2 or 3 lessons, the patients and the family are trained. Is not difficult. The program is different from a patient to another one. Some programs can close in a few months, and for some others, it depends from the severity of the deafness.
Are you still seeing patients from all over Italy, or are you seeing as many patients from, let's say, southern Italy now that there are more centers doing video rehab?
At the beginning, we were the only one in Italy, and I think that also now, only during the COVID time, some centers use the video conference.
Do you think that will change after COVID?
Many things for us, because the patients didn't come to the center for 2 months and a half, more or less 3 months. All the patients were very happy, first of all, to have a connection, a daily connection with us, because they were not alone. Sometimes they didn't do rehabilitation, but they wanted only to speak with us.
Sure.
And another thing that we obliged them to work every day, because usually we follow them once a week,
Sure.
Twice a week, depends. In that case, we want to follow them every day, and so we performed more or less over the 50 or 60 connection per day.
Wow.
And we followed over then 500 patients during that period.
That's a lot of connections per day. How did you manage that in terms of staffing?
Because in our staff, we have 7 speech therapists.
Okay.
And 3 pedagogists. They are like teacher. The pedagogist is like a teacher, and they are working in our center. And so we have 10 professionals connected daily with the patients, and all the professionals in that period didn't came to the center because they cannot, and so they work in a smart working.
So just work from home.
Yes, and so they connected from home to another room, and in a very informal way. Also, this thing changed for us, and it was the first time for us.
When you have patients that have hearing aids versus cochlear implants, is there any difference in the way that you approach rehab?
Yes, of course, because in our method, the cochlear implant is the end of a program, not the beginning. If they are children, usually congenital deafness, usually we follow them for 8 or 9 months before the cochlear implant, and we put the cochlear implant, and we follow them after the cochlear implant for other 6, 8 months after cochlear implant. If they are elderly or the adults, the program is different, but also in this case, we follow them before the cochlear implant many times, and after the cochlear implant is not necessary usually, because we can reach a good result in a very few months.
You mentioned earlier that you guys are measuring outcomes for these patients that you follow, and that you actually saw patients get to a better outcome quicker when you were following them at home. How do you measure outcomes? What does that look like? What are you relying on to determine what a good outcome looks like?
We measure these results in 2 ways. The first one is by questionnaire, so we can check their disability at home, at school, and so on. And we measure also with audiological tests. In video conference, we can measure their discrimination results with very, very simple tests.
Yeah.
And we can show them. And this is very important because at the beginning, you said me that you couldn't hear something, but not by voice, by numbers.
Sure.
Okay. We have checked by questionnaire. And now with the same questionnaire, after months of rehabilitation, you have reached this result. And so you can't say me, I cannot hear this sound, I not happy. No, it's not correct. You said me with this questionnaire that your situation is better than before.
And you're a surgeon, correct?
Yes.
There aren't many surgeons that are fully across all the details of rehabilitation and some of these other audiological measures. And I'm just curious, what sparked your interest, or how did you become so involved in the whole care ecosystem?
Unfortunately, usually the surgeon is the surgeon, the audiologist is the audiologist, the speech therapist is the speech therapist, and so on. In our center is quite different because we live in the same building all together. We share the rooms and we share daily informations about rehabilitation, cochlear implant, hearing aid, and also about surgery. So yesterday I was in the surgical room. I operated a very small kit. And after the operation, I sent a message on the WhatsApp group about the details of the surgery. Why? Because all the group has to know every details about every patient. If a hearing aid is not going on, the surgeon has to be able to know and also to manage a very simple thing. Why? Because the first thing is because the patient has the sensation to be in a center where everyone knows him or her, and it's very important for them. But it's very difficult.
Yeah. I mean, that's a really novel approach, I think, where you have everyone under one roof. Let's say that you do the surgery for an infant. Do you get reports, a year or two later in terms of how that child is performing or progressing?
Yes, of course. We follow this child all the time, usually till 3 years of age.
Why do you think other centers, whether in Italy, Europe, or the rest of the world, haven't adopted a similar approach to your center, where you have this interdisciplinary team of professionals all under one building?
It's very difficult to build a team like this one. It's very difficult, especially in Italy. Why? Because for the economical point of view, because you need many money, many professionals to manage big numbers of patients. I think and I hope that also other centers in Italy in the time will change their method, and because I think this is a very, very good way to work and to obtain good results. But the future is this. The future is telerehabilitation, telemedicine, the robotic surgery, the artificial intelligence, and many other devices. And so the future is this. We have to prepare, and I'm sure that in the next 10 years, all the healthcare system in the world will change, and the professional have to be ready for this change.
Absolutely.
I'm fascinated by technology because technology is well managed, is able to change the life of millions of people in the world in a very simple way, if you use in a very good way. Now we are talking about something, our lives, our work, and we are in the opposite part of the world. And for me, it's fantastic. We are citizens of a global world in a very, very easy way. And also for the deaf patients. I hope a world in which deafness will not be a problem. It's a normal problem, like eyes or other things. Yes, it's not a stigma.
So you guys use a lot of technology to do remote encounters. Do you guys ever recommend rehab apps or maybe listening to podcasts or something that patients can do in between? their clinic visits?
We usually, yes, use audio books for them, usually. And many years ago, a CD containing many exercises they can have at home, and so they can use. But one of the goals of our center is to prepare videos or tutorials and maybe other things because we think that it's a good idea for the future, especially in this time, but also for the future.
You and your team have built such an incredible center. For other physicians or audiologists that are listening to this podcast who'd like to emulate a model that you have in Italy, what recommendations, what advice do you have? What lessons have you learned, and what would you say to those people?
The first recommendation is work together. Work together and work together. The surgeon has not to be only a surgeon, but has to be very curious and has to move to the mapping room and to follow the audiologist during the map or during the hearing aid fitting, and have to study, have to learn many things. And the surgeon has to go to the rehabilitating room and follow the speech therapist during the rehabilitation, and has to study fundamentals of rehabilitation for kids, for very small kids, for children, for adults and elderly, because without this kind of work you are alone. And you are concentrated on only one problem, but deafness is not only an ear. Deafness is a total problem, and you have to be also a psychologist, and so we have to know all the problem of deafness, and so I think this is the only way, and the best way to do it is to do it in the same building, not in different. If you have a problem, you can discuss immediately, and you can solve in that moment.
That's fantastic. I think this is such a fascinating time in hearing care, because we're starting to see all of these technologies in consumer electronics. And then those get quickly adapted into hearing aids and cochlear implants. And I think
we are looking at the future, because the future is now, and so it's very, very, very exciting for us, because we have the future on our hands, and we have to manage it very, very well for the patients and also for us.
Absolutely. Dr. Cristofari, thank you so much for joining us today and for waking up early, especially. It's been a really fascinating conversation, and I really enjoyed learning about what you guys have built in Italy.
Thank you to you, and thank you to all the team. And I'm very, very happy to share that with you our concept, and I hope in a global best future for the world, not only for the COVID time, but especially for the deafness. I hope so.
And thank you for listening to today's podcast. If you enjoyed it, please make sure you press the subscribe button and give us a rating and a review. If there's a particular topic you'd like us to cover, please mention it in your review. We'd love to hear from you. You can find all the links to what was discussed in today's podcast in the description, and stay tuned for our next episode. In the meantime, stay safe. Just a quick reminder, the views of the interviewees in this podcast are their own and do not necessarily represent the views of Cochlear Limited or its subsidiaries. This material is intended for health professionals. If you are a person with hearing loss or a member of the general public, please seek advice from your health professional about treatments for hearing loss. Outcomes may vary, and your health professional will advise about the factors which could affect your outcome.